Hello there, ma'am. My name is Ryan Martin. I'm going to be the nursing student doing your head to toe assessment today. Would you mind stating to the camera your full name and your full name,
Jillian Robertson,
and your age, ma'am?
22.
Okay, Ms. Robertson, would you mind also stating to the camera that you um, do consent to video and audio recording for this assessment for JMU RN to BSN program?
Yes.
You do consent. Very well. So we'll begin our assessment, and first I'm going to be assessing the patient's skin grossly. I see that the patient has normal skin color for her ethnicity. I don't see any obvious diaphoresis at this time. Texture appears to be smooth. It is. She is warm to the touch. I'm assessing for turgor. I don't see any tinting at this time, and her skin appears to be grossly intact. Moving along to her head and face, the patient's head appears to be normocephalic. I see that everything appears to be midline and symmetrical. I don't see any trachea deviation. I see no signs of JVD. Assessing her ears, there appears to be no abnormalities with her ears. Grossly, I see no discharge from the ears, from the eyes, nose, or mouth. Her hair appears to be well nourished. I see no flaking. I do see some hair dye, but that is okay. Using my flashlight here, I'm going to be looking in the ears. I don't see any fluid or abnormal discharge at this time. The same with her nose. I'm going to assess the pupils at this time. Ma'am, just go ahead and look at my shoulder here. I'm going to be shining a light in your eyes here. So her pupils appear to be round in shape. They're equal, round, and reactive to light and accommodation. Sizing them, they appear to be 3 millimeters in diameter, and they react briskly to light stimulation. Her sclera appears to be white. It's non-icteric. I don't see any signs of conjunctivitis or any other discharge. Having the patient open her mouth and also inspecting the interior of the mouth. The tongue appears to be intact. It's pink and moist, as is all of the other portions of her mouth. The uvula appears to be midline, not swollen, and also is pink and moist. With her neck, I'm also going to be assessing and palpating the various lymph nodes. Any tenderness in there, ma'am? So I don't feel any swelling. Most of her lymph nodes are actually non-palpable at this time. I am also going to palpate the temporomandibular joint. Go ahead and open your mouth, ma'am, and shut it. So her mandible moves freely on this joint. I don't feel any step off, no crepitus, and no other abnormalities with that. Now, assessing her cardinal fields of gaze, I'm going to have the patient, with your eyes, just follow my finger. Don't move your neck. Just go ahead and follow my finger. And again, this is assessing the patient's cardinal fields of gaze. So far, they appear to be intact, and I see no signs of nystagmus evaluating the patient's eyes. Now, the patient does wear corrective lenses, and I will note that in the chart. I don't see any hearing aids or any other issues with hearing at this time. So moving along, ma'am, go ahead, and this time we're going to do it with your neck not moving your eyes. So just look up to the ceiling and down to the floor and back at me and to the window and to the television and back midline. Any tenderness there? Okay. So range of motion in the neck appears to be intact and no pain at this time. So next I'm going to be moving to the thorax and chest region of the patient's assessment. Um, Inspecting here, I'm going to inspect and count a respiratory rate using my stopwatch. The patient appears to have a respiratory rate of 16, which is normal. Also evaluating, I see normal chest rise and fall, and it is symmetrical. I don't see any heaves, lifts, or any retractions upon the patient breathing and assessing the circulatory status of the patient. Um, Next, I'm going to auscultate your lung sounds, ma'am. So you can take a couple deep breaths when I touch the stethoscope to your chest. And go ahead and sit forward. So on auscultation, the patient has clear breath sounds bilaterally. I note no abnormalities with the stethoscope. The patient has normal bronchial, bronchovesicular, and vesicular sounds. Next, I'm going to assess the patient's heart sounds. So the patient has audible S1 and S2 sounds, no murmurs, no rubs, and no gallops at this time. I have assessed the atrial, pulmonic, Erb's point, the tricuspid, and the apical pulse as well. Moving along to the patient's abdomen. Inspecting the abdomen, I see it is slightly rounded. Of note, the patient is 31 weeks gestation pregnancy. It is rounded. She appears to be breathing. I don't see any gross abnormalities at this time. Next, I'm going to auscultate bowel sounds in all four quadrants. Bowel sounds are normal, active at this time. I also hear a somewhat active fetus at this time. So next I'm going to palpate. Any tenderness here, ma'am? So the patient reports no tenderness to her abdomen. Again, it appears rounded. I would say it is soft upon palpation, and she reports no rebound tenderness in the abdomen. Next, I'm going to, well, at least last for the abdomen, I'm going to do some percussion. And I hear tympanic sounds with percussion on the abdomen. So moving to neurological assessment, I'm going to have the patient close your eyes and tell me which arm I'm touching. Right. And which arm? Left. And which arm? Left. Very well. So next, I'm going to have you stand up, ma'am, just for a moment. And go ahead and close your eyes and lift your left leg up and just hold it to your right knee if you can. Okay, now do it with your other side. Very well. You can sit back down. Patient does have limited balance at this time, and I will note that. So the patient's circulatory status, I'm going to finish up by assessing pulses here. Radial pulses are +2 and equal, and pedal pulses are as well. I am noting +1 edema in the feet at this time. So this concludes our head-to-toe assessment, ma'am. I thank you for your participation, and I will note my findings in your medical record. Thank you. Did it turn off? I hope it didn't turn off.